We have a state of emergency in our city. We have a request now that says all of us, all governments, should simply get together and get a deal done that makes sense for Central Alberta. Does that not make sense to you?
This document is titled 2016 Multi-Year Facility Infrastructure Capital Submission, dated October 6th of 2016. This document, produced by Alberta Health Services, listed 21 priority projects for the province. None involved new infrastructure dollars or beds for Central Alberta or Central Zone. Billions of dollars in healthcare were announced for Edmonton and Calgary. Red Deer was taken off of the list. Central Alberta needs a new type of hospital, Red Deer. The Red Deer Regional Hospital needs to be expanded to meet the basic needs of the population more effectively, but as well it needs to be expanded to accommodate new programs that will allow the delivery of advanced care to Central Alberta. We need COPD clinics, inflammatory bowel disease clinics, urgent assessment clinics, a new dialysis unit and clinics, to mention a few.
In the next 4 years, $4.492 billion of added infrastructure provincially. Not $1 is specifically allocated to health care facility development in Red Deer or Central Alberta. We are calling for a business case to expand the Red Deer Regional Hospital and to make expansion of the Red Deer Regional Hospital a priority funded project.
We all have to keep it at the forefront. I mean, it's great to come to a rally, but everybody in Central Alberta needs to keep talking to everybody about it. I know from a lot of people just how badly the services are needed, and I know a lot of people who work for Alberta Health Services and just how overworked and over capacity we are with our resources.
There was representation from all the frontline workers. Met with the health minister earlier this year too about. I think she was, she really did want to hear from the frontline staff about their concerns and their input. But there hasn't been a lot of follow-up with those concerns that were brought forward. And one of the common ones was staffing levels among all groups. They felt it was just not sufficient, and that was kind of the message I think she left with.
Well, I'd like to see a response from our government, from Alberta Health Services, acknowledging that the issue exists, that the issue is true, the issue is real, and moving forward, I think we absolutely have to be back on the urgent priority list, and we absolutely have to appear in the budget for at least a business plan, to have a look, feasibility study, something that will get us closer to where we need to be. And what we really need, ultimately, what we really need is a new tower, Red Deer Regional Hospital redevelopment, expansion. We need to be able to take care of our patients locally where they deserve to be taken care of.
Our council, in response to community concern this past spring, adopted an official advocacy motion requesting that the provincial government reprioritize Red Deer to the top of their capital priority list in recognition of the identified needs of the Red Deer Regional Hospital. I fully would expect that our hope would be that a formal response would come back from the minister, either in writing or by way of the provincial budget in 2018, that the needs of Red Deer are important, and that they have been recognized, and that a plan would be tabled to fund the infrastructure and service needs of the hospital.
I just want you to know that I share the frustrations, and I'm listening, and I'm taking all the concerns forward to my government colleagues.